Hello, my name is Erma Leaphart. I am a lifelong resident of the city of Detroit. I'm a mother, a grandmother, and a great-grandmother. I currently work for the Sierra Club, Michigan chapter, as a community organizer and Great Lakes advocate. The food we eat, the air we're breathing, the water that we drink, are all determining factors in our health from birth to old age. But too often we are not aware of the dangers or addressing the dangers that are within our air, water, and food seem just too far out of our control. But when regular folk, community members, people of all stripes, and in particular those who are most impacted, work closely with the scientists, academic researchers, and policymakers, we can and we do make a difference in improving our lives and the lives of others. I am really grateful to be able to join with, be a collaborator with the M-LEEaD Center to help identify some of these dangerous exposures, environmental exposures, and collaborating on research projects, and then most importantly, translating or taking the information that we learn to advocate for different policies, better policies that will protect us from these dangers. Knowing both problems and solutions, we can begin to see improvements. We can begin to be better collaborators, more informed decision makers. Thank you so much for all that you do.
Hi, I'm Kathryn Savoie, and I'm the Director of Equity and Environmental Justice at the Ecology Center, and I'm also one of the conveners of a local coalition called Clear the Air, which is working for everybody's right to breathe safe, clean, healthy air. They've been really important in a couple of the campaigns that we've run, providing research that supports our goals as a community, including our efforts to promote cumulative impact policy here in Michigan. So they've really done a lot of work that provides data and research to support our goals of seeing policy change that really helps address inequities in overburdened communities.
And it's such an important part of the work we do at We the People of Detroit. We enter this work centering our community, never assuming that we know what's best for our community. We live in our community, so we are not separate from the very people that we're speaking of, but many of the experts are not the practitioners and statisticians and researchers that you know. It's really that voice of that big mama or that grandfather that sits on the porch and watches all the activity that happens on the street. Those are the people that, one, are shaping the questions that we are seeking scientific and data to be able to either validate or dispute. They also are driving the accountability in terms of how we shape and weigh in on policy. And then I think the critical thing that we have learned from amazing practitioners and scholars, that kind of intentional work, not so much to do research for research's sake, but doing research that is moving the needle for systemic change. That is the powerful moment that we're in. We need work that is grounded in being able to be humble enough to lean into community, and yet brilliant enough to understand that your science and research and expertise are needed.